This is an update on where we stand on health care reform. First, the good news. 12 days ago, the House passed a bill that would help provide health care for all Americans and would pay for it by making those who don't provide health care, the deadbeat employers, either provide health care for their employees or else pay for it with an 8% payroll tax. It's a progressive bill, one that we can be proud of. Hundreds of thousands of CWAers made calls and helped get that passed. That's the good news. The bad news is, just an hour ago, the Senate leader, Harry Reid, announced the Senate bill that will now go to the Senate floor. And that bill would tax our health benefits. That bill, within 3 or 4 years, would actually have taxes on our health benefit plans that could amount to thousands of dollars per year. Here we are, CWA, across the country. We've been mobilizing in contract fights to make sure that we maintain our benefits or even improve them. And now, if the Senate bill goes through, we would actually have our plans being taxed. Unthinkable, but accurate. So what do we have to do? We have to make it clear to the House that the way they did it was the right way. And in fact, thanks to CWA and other organizations, almost 200 House members signed a letter to the Speaker of the House saying, don't tax our benefits. Don't tax middle-class health care benefits. They need to stand by that letter in the House and say they will not vote for a conference bill, meaning that after the Senate passes the bill, it then goes to conference. And the Senate and House get together with the White House and decide what will be in the final bill. We have to mobilize now, in the weeks ahead, and say in the Senate, in the House, and to the White House, don't tax our benefits. This means every work site passing around cell phones. We have over 100 people off the job, mobilizing in every state, passing around cell phones with the phone numbers of how to call your member of Congress, how to call your senator, and soon we'll be calling the White House as well, to put everybody on notice. We won't stand for so-called health care reform that pays for health care reform by attacking the living standards of middle-class, working-class Americans during the worst recession in 75 years. We need to lift up our living standards, not tear them down with taxes on our health care benefits. So CWAers across the country, every work site, every sector of our union, every region, every congressional district, mobilize, mobilize, mobilize. The time is now.